Healthcare in this country, especially before the Affordable Care Act, is a luxury item.
We were taking care of ourselves, trying to stay out of the system, yet the system was really punishing us.
I felt like if this happened to me, when I knew the right questions to ask, it could happen to anyone.
If health for all really meant health for all.
That's exhausting when the top priority for me right now is to maintain the quality of life that I should have, but instead I'm fighting for basic care.
Health insurance is a right. It's not a privilege. It should be for everyone.
I lose my insurance. It's a real life and death situation.
I have a severe form of arthritis called ankylosing spondylitis. I also have PTSD, major depression, and anxiety. I have infusions. I go to an infusion center and a cancer care center for a specialized drug that basically manages my disease so that I'm not bedridden all the time. Well, it's in the thousands per dose, and it's every 8 weeks for me. Listening to one of the panelists describe that it's almost certain that Medicaid expansion will be gone is a direct threat to me because I survive on Medicaid. When people are sick, they should be focusing on their health care, right? Taking care of their day-to-day functioning. And often those with severe chronic diseases are actually fighting for the care they need in order to survive.
That's got to come out right away. And so that's when the crazy train left the station. I felt like such a loser. I blurted out, I'm not a deadbeat. I'm a mom with kids, I have a house. I'm not a deadbeat, but what am I gonna do? It was too good to be true. I just couldn't believe it. I call them, I qualified. So the next thing I know, I've got insurance. I've always landed on my feet. I've got some great stories. This is the best one of all. You think I'm gonna die and then I'm saved by the President of the United States. If I lose my insurance and I have this thing comes back, it's like $500,000 to go through what I went through.
At first I thought, thank God I have insurance, because cancer is definitely a catastrophic disease. I'll be covered. And then I found out, one thing at a time, the rude awakening, that I was going to have to pay out of pocket. I was piling up medical bills. I joked, I said, my cancer's in remission, but my debt's metastasizing. Being told, I'm sorry, ma'am, but your insurance won't cover these and they're $100 a pill. Do you still want them? Well, did I want anti-nausea medicines before? Yeah, of course I want them. And I got this flash in my artist's mind of jewelry made with pills. People have been wonderful donating their old pills, and I turn them into gems. And I take the gems and I turn them into jewelry. Nancy from Health Access would tell her legislators that you've got a constituent in her 50s who's having to sell drugs to pay her medical bill. I'm nervous now for everybody. I'm nervous because of the threat to people that might lose their coverage.
I'm really glad to have been part of the work that Health Access has been doing. A lot of us, working class, working poor, around all races, we don't think about our health until we're bedridden. But if we start taking those active steps, I think that we'd really start seeing the importance of having that health, access to health as an important thing for all of us. In LA in particular, I come from Los Angeles, we were able to push the County Board of Supervisors to provide primary health care services to undocumented people. My mom and I are both beneficiaries of My Health LA. I think what I would love to see in terms of health access is everyone having to not worry about it being affordable and whatever that looks like. But I would love to see everyone in California have access, everyone in the United States have access to health, quality health, and access to mental health included in that.
And they said, oh, it's probably just bookkeeping, it hasn't caught up with, the records haven't caught up. Went ahead with the procedure, and then several weeks later got a bill because I had an out-of-network anesthesiologist. But I did stop getting the bill, so I thought, okay, finally they took care of it. Except I found that I was then turned over to collections. If this happened to me, when I knew the right questions to ask, when I questioned them in advance, it could happen to anyone. It was something that I felt was ethically wrong. Patients have a lot to worry about. They're in a really vulnerable state, and their bills should not be unexpected.
I was getting upset with the health insurance companies because our premiums were escalating based on numbers. Our age and our zip code had nothing to do with us and our health. So when we hit the above 55 mark and went into that next chunk, we got hit with a 26% increase. The price keeps going up, and the coverage keeps going down, the deductible keeps going up. And we look at each other and go, you know what? We can't afford $12,000, $15,000 a year. For what? But I'm bracing for the worst. I really am. And I gotta tell you, I don't wanna have to make that decision of, okay, am I gonna be able to pay for this or not?